LCSW Test Practice Social Worker Practice Exam and Study Guide, 25 Most Repeated Questions. Question 1. A client presents in crisis. What is the social worker's first priority? Developing a treatment plan, assessing for safety and suicidally, reviewing insurance coverage, referral to a support group. In crisis intervention, safety is always the primary concern. Question 2. According to the ASWB Code of Ethics, what is informed consent? The right of the client to refuse any service. The client's right to know the worker's home address. Informing the client about the risks, costs, and alternatives to treatment. The worker's right to share files with anyone. Informed consent ensures clients understand what they are agreeing to. Question 3. A social worker receives a subpoena for client records. What is the first step? Send the records immediately. Delete the records. Contact the client and consult with legal counsel. Ignore the subpoena. Social workers must protect confidentiality and follow legal/ethical protocols for subpoenas. Question 4. Which DSM-5 diagnosis is characterized by a persistent pattern of detachment from social relationships? Borderline personality disorder, schizoid personality disorder, avoidant personality disorder, narcissistic personality disorder. Schizoid personality involves social detachment and restricted emotional expression. Question 5. In systems theory, what is homeostasis? The tendency of a system to maintain stability, a state of constant change, the input of new energy, the breakdown of a system. Homeostasis is the tendency of a system, like a family, to seek equilibrium. Question 6. A social worker is working with a family where the child is being bullied. What is the most appropriate macro intervention? Individual therapy for the child, family therapy, working with the school to develop anti-bullying policies, teaching the child defense moves. Macro intervention involves changing systems or policies to benefit many. Question 7. Which theory focuses on the stages of cognitive development in children? Erikson's psychosocial theory, Piaget's theory, Freud's psychosexual theory, Maslow's hierarchy. Jean Piaget's theory describes how children construct a mental model of the world. Question 8. What is the primary goal of the initial phase of treatment? Resolution of core conflicts, establishing rapport and a therapeutic alliance, terminating the relationship, implementing behavior modification. Building a relationship is critical for any successful intervention. Question 9. A client tells a social worker they intend to harm a specific person. What is the social worker's duty? Maintain confidentiality. Duty to warn/protect the intended victim. Encourage the client to take a nap. Report it to the social work board only. Tarasov v. Regents established the duty to warn third parties of imminent harm. Question 10. What is transference in a clinical setting? The social worker's feelings toward the client. The client's feelings projected onto the social worker. Moving a client to another agency. Sharing data between colleagues. Transference occurs when a client redirects feelings for another person onto the therapist. Question 11. In the DSM-5, which disorder involves cycles of mania and depression? Major depressive disorder, bipolar I disorder, cyclothymic disorder, dysthymic disorder. Bipolar I is defined by at least one manic episode. Question 12. Which ethical principle refers to the client's right to make their own decisions? Self-determination, competence, integrity, social justice. Self-determination is a core value allowing clients to choose their path. Question 13. A 14-year-old client admits to occasional marijuana use. The parents demand to see the therapy notes. What should the social worker do first? Hand over the notes. Refuse and terminate the client. Review state laws and the therapeutic agreement regarding minor confidentiality. Tell the school counselor. Confidentiality rules for minors vary by state and individual treatment contracts. Question 14. Which therapeutic approach focuses on changing irrational thoughts? Psychodynamic therapy, cognitive behavioral therapy, CBT, humanistic therapy, Gestalt therapy. CBT focuses on the link between thoughts, feelings, and behaviors. Question 15. A social worker is conducting an assessment and notices the client has poor hygiene and a flat affect. Which section of the report should this be in? Reason for referral, mental status exam, developmental history, recommendations. Appearance and effect are components of a mental status exam, MSE. Question 16. What does dual relationships refer to in social work? Treating two clients at once, having a professional and a personal/social relationship with a client, working for two different agencies, using two different theories. Dual relationships can impair professional judgment and are generally avoided. Question 17. Which tool is used to map out family relationships over 3 generations? Ecomap, genogram, social network map, flowchart. A genogram is a pictorial display of a person's family relationships and medical history. Question 18. If a client is at high risk for suicide, what is the most appropriate action? Schedule an appointment for next week. Involuntary or voluntary hospitalization/safety plan. Give the client a self-help book. Call the client's employer. Immediate safety intervention is required for active suicidal ideation. Question 19. What is countertransference? The therapist's emotional reaction to the client. The client's reaction to the therapist. The process of ending therapy. A method of billing. Countertransference is the therapist's own feelings projected onto the client. Question 20. Which social work role involves speaking on behalf of a client to ensure they get services? Educator, broker, advocate, researcher. An advocate champions the rights of clients.